The ever-increasing cost of drugs is having a profound impact on the practice of oncology and practices delivering care. When I got to ASCO in 2006 and drug prices were hitting $50,000, I said, we're at a crisis point. They're now at $150,000 and they will soon be at $200,000. And we begin to use these drugs in combination. So it is really here today that you're almost writing million-dollar prescriptions for patients. This puts tremendous pressure on practices because insurance ramps up prior authorization to try to get you to not give these drugs. And so it's an arms race with payer having rooms full of people saying no, and our practices having to have higher rooms full of people to counter that. We see pressure on the way we're reimbursed because of the high prices contributing, in some people's minds, too much revenue into practices. And of course, we see huge impact on our patients, their families, their financial futures, their ability to receive these therapies, especially oral therapies, which patients are abandoning because of the copays and the high costs. So we have to get control of this. What can we do? Many drugs are used in doses that are far in excess of what's necessary. This is not surprising. What makes us think that the company's selection of the dose is miraculously perfect every time? It isn't. And sometimes it's overestimated. We have a list of 25 or 30 drugs that we believe are given in doses that are far in excess of what's needed. It's simple to run a clinical trial. Take the label dose, treat half the patients, take a lower dose or a different schedule and treat half the patients, and compare the outcomes. We're almost certain that we will find ways to reduce not the price of the drug, but the costs our patients have to pay because we'll use less of the agent. And we think that this is a responsibility of the oncology community, and I hope we can get this done.